Hello and welcome to Round Table. How much easier is it to live in the 21st century than in times gone by? By most counts, mortality, education, disease, it is a great deal easier. But what about mental health? Are times tougher now, or are we just more aware of the issues and prepared to discuss them? The USA was ranked third globally in 2017 by the World Health Organization when it comes to having what's described as the biggest burden when it comes to mental health and behavioral disorders. If one of the wealthiest nations on earth is doing so badly, what hope is there for those who are suffering elsewhere? Very good to have your company. I'm David Foster. On this show, we'll ask the World Health Organization what it's doing to tackle what is a particular problem for young people. We'll hear what new pressures they are under from a psychiatrist and a psychologist. And we'll hear the personal story of a mother whose daughter contemplated suicide. The pandemic has created a mental health crisis for young people. According to the OECD, the Organization for Economic Cooperation and Development, for those between 15 and 24, mental health has worsened significantly in the years 2020 and 2021, with most countries reporting that mental health issues among this age group have doubled or more. In March 2021, young people were 30 to 80% more likely to report symptoms of depression or anxiety than adults in Belgium, France, and the United States. This October the 10th World Mental Health Day is set to raise awareness of mental health issues around the world and to mobilize efforts in support of this health crisis. Will one day be enough to raise the alarm about mental health? Well, let us go first of all to Paris on this round table, and we welcome Ledia Lazeri, the World Health Organization's Europe Mental Health Team, then to West Cumbria in the UK, and Jayne Gooch is there, the mother of a teenager suffering with mental health issues who talked of suicide. In the studio we have Elena Antonova, Senior Lecturer at the Division of Psychology at Brunel University, and Dr. Cyrus Abbasian, Consultant Psychiatrist. Ledia, I will come to you to talk about the bigger picture in just a moment, but I want to get very personal, Jayne, if I may, and play a clip of what must have been an absolute nightmare for you as a mother, followed by some words from a final year student at Brunel University in London.
Hi. Our mental health services for our young people in West Cumbria, Cumbria and the UK is failing them. Earlier this year, in March, my child tried to commit suicide. She's also been self-harming, and the support we've had has been appalling. Today, I received a call from the school to say they couldn't look after her because she was suicidal. We came into A&E at 11 o'clock this morning. It is now 5 o'clock. They've called the crisis team 3 times, and the crisis team have not been out. I've told them that I'm not taking her home because she needs to get support. I can no longer live with not knowing if I'm going to find my daughter dead or alive every morning when we wake up. We have to get better support for our children. We have to get mental health workers helping our children. We have to get crisis team not waiting until a suicide attempt to help them. If they are thinking dark thoughts, they should be with them immediately. So please share this video, tag your stories, let's get children's mental health on the agenda.
The more you hear about this, obviously the scarier it gets, and the more anxious that you kind of are, and the more anxiety you start to develop anxiety, just kind of hoping that no one that you know or anyone else had this contagious and horrible disease. But I think for me, I was quite fortunate that I could literally go home the minute the university said to pack your things and just go.
So there we have it. It's heartbreaking, Jayne, isn't it? I know that your daughter is recovering, you hope, fully. But did you feel that you'd been completely let down that first day?
Oh,
absolutely. It was our second time at dealing with the crisis team, having had her have an attempt on her life back in March. And the video was the most recent case when we went to hospital. And you know, I wanted to put the video on social media to raise the awareness of how children and families are being failed mental health service.
They wouldn't let you or her remain in the hospital that night. Did they give a reason why she had to go home when she was begging that she be admitted?
No, not really. I mean, we'd been at the hospital for nearly 11 hours when we finally saw a member of the crisis team who's maybe 6-7 minutes with us. And they went through the normal questions with regards to how you're feeling, what suicidal thoughts are you having. She told them that she'd made a plan, and they told her, well, you haven't done it yet, which really feels a little bit like a challenge. And then when she asked to stay into hospital, they said, no, you have to go home. And she said, but I feel safe here. I feel safe with doctors and nurses. I can't guarantee if I go home, I won't take my life. And she was crying at this point, really, really upset. And I started crying and saying, look, I can't take her home. I haven't for 2 days. And I just can't make sure that she's safe. And we both told that we didn't have a choice and we had to go home.
Did they give you a reason?
No, just that the hospital doesn't offer that service. So that our hospital staff, the nurses, the doctors, were absolutely fantastic. They looked after us really, really well. But the crisis team wanted to get us home and just have us deal with it on our own.
Jayne, I'm going to come back to you a little bit later and ask you about your daughter's health at the moment, what you're hoping to achieve by putting this story out there. But Ledia, let me come to you. World Health Organization's mental health team in Europe. This is by no means an isolated, even if it is a very personal case. We've seen a massive rise in the mental ill health of young people. Why is that, do you think?
Certainly there is a spike in cases of mental distress and mental ill health, as you said. Not only the young people, but in the general, in a number of segments of society that have either been vulnerable before or have been exposed to new vulnerabilities. For instance, children, adolescents, and younger people were already subjected to vulnerabilities due to a number of changes in their lives. Adolescence is a difficult period for all, but also the changes in the lifestyle, for instance, online, living an online life, etc., that is poorly regulated. It's another vulnerability to which our youngsters have been exposed. So have been older people, for instance, exposed to isolation due to lockdowns, etc. Healthcare professionals were another segment of the society, another group of the society that were suddenly exposed to an incredible vulnerability due to the overwhelming pressure on their work life, and so on and so forth. There are all the other vulnerable groups, such as minorities, LGBTI, etc., women, that have been exposed to an increased domestic violence. So all in all, the pandemic has uncovered existing vulnerabilities or has put an emphasis on new vulnerabilities that the society was not prepared.
May I interrupt here? Rather like being caught unawares by the pandemic when we shouldn't have been, when we should have been prepared, should we, and you as a mental health expert and other people in your field, should you have been aware that this was likely to happen?
Health systems were ill prepared to cope with the pandemic, as they were ill prepared to address mental health challenges before. Even before the pandemic, the burden of mental health has been high. Only nearly one-fifth of our population of the non-fatal burden of disease was due to mental health and mental ill health and substance use disorders. And the economic cost of mental ill health in the European Union alone is more than 4 billion euros. So the burden of mental ill health has already been there. The treatment gap has already been there. In the EU, only 1 in 3 people who are experiencing depression get any type of care. And this figure is worse if you go further eastward to the region. So our health systems have been chronically underfunded. Mental health has been chronically under-prioritized, which means that the systems were ill-prepared to cope with the expansion of need and demand that came due to the pandemic.
Ledia,
And this is...
I hope
Yes?
to come back to you in just a moment, but I want to bring in our other guests at this particular point. Stay with us, if you would. And this is for both of you. Elena, I'll come to you first of all. I posed the question at the top of the programme, whether in fact living in the 21st century is more difficult for people generally, when in fact by all other indicators, mortality, disease, education, the amount of available capital, we should be better off. Why do you think we are now hitting this point?
The demands of modern life, the dynamic of modern life, the pressures that our children at school are put under with continuous examinations, universities, work, just the sheer dynamic and the demands, continuous demands, I think keeps us in the state of high alert, regardless of gender.
But didn't these pressures, even if they were different pressures, exist for my parents' generation, their parents' generation? That they didn't know where they were going, they were wondering what they ought to do, they didn't have enough money, there was disease. Weren't those pressures always there?
Some pressures were always there, but I think the sheer pace of life, the absence of time to spend quality time with the family, the absence, and this has been exacerbated by pandemic, of the communal support, of the communal living. I think it's affecting us individually and societally in terms of our mental well-being.
Cyrus, why are more people openly admitting to this? That may be a societal thing because we're asking them to come forward, but why are more people seemingly afflicted by this now than they ever were?
Well, people are more willing to talk about mental health issues, and there have been a lot of government campaigns, particularly focusing on men, sort of young men, I mean, between sort of my age or between the age of 20 and 50, regarding suicide and depression. And I think as a society, we're accepting that mental health problems are problematic, that there should be parity between mental and physical health. And that if, as a man or any person, if you have any mental health issues, if you're struggling, if you're depressed, anxious, you go to your doctor, you go to a professional, you seek help. And that talking about being depressed and suicidal is really important.
Well, there was a survey, admittedly not a very scientific one, according to what I read, that said in 2017, 1 in 9 children, young people, were able to admit that they had mental health issues. That number now is 1 in 6. Is it simply the pandemic that's caused that rise, if there is one, in the last 4 years?
Well, I mean, in the past 18 months or so, certainly pandemic has contributed to it. At the beginning of it, I remember in April of last year, the focus from doctors, scientists, governments was the first wave. I mean, and as a psychiatrist and many mental health professionals, we're talking about future waves. And we're seeing it right now in terms of the mental health crisis, the anxiety. The term COVID anxiety is being used to describe a lot of young people who are completely overwhelmed in this permanent fight and flight state because of being bombarded with information regarding COVID, washing their hands, wearing masks and all that. And also a lot of young people haven't had the chance to grow up, haven't had a chance to socialize with others, go to college. First year at university is really important.
Yeah.
And we have a whole generation whereby first year at university was remote and they've missed out on a large chunk of their life and growing up.
Can I read these figures out? This is to do with mental health disorders by age group, boys, girls, and then everybody. When you're 6 to 10, boys seemingly have the biggest issues. Then when you get into the early adolescent years, it's boys down a bit, girls up a bit, more so than the rest of the population. You get to the 17-year-olds and the girls are just way, way out in front. So, Jayne, I wanted to ask you, your daughter's anxieties, because she was in this 11 to 16-year-old age group, your daughter's anxieties were brought about by what, do you think? What does she think caused them?
Well, unfortunately, we've not been able to pinpoint exactly what has caused the trigger, which is why she's such high risk. How she explains it is that she just has these awfully dark thoughts where she just doesn't feel she should be here, she hasn't value being here, she just feels that she just does not want to live anymore. But, you know, been said because this has been a problem before the pandemic. So many parents reached out to me from the video put out saying that their children, 10 years plus, have been failed again and again. And some have even lost their children whilst they were waiting for some sort of mental health support.
So she has no idea. What are your thoughts on this?
I think a lot of it is down to social media pressures. I think social media has a lot to answer for young children and adolescents. I think potentially it's a mental health imbalance. So whether we'd had a pandemic or not, she would be feeling the way that she feels. But without a diagnosis, it's very, very hard. And we cannot get in front of CAMHS, which means we can't get a diagnosis for her.
Thank you. I'll come back to you and ask you where you're hoping to take this, Jayne, if I may. But Ledia, again, another distressing story from the mother of a teenage girl there. What do you think mental health professionals and those who fund the people who try to cure these illnesses, what do you think they can do now?
I think it goes beyond mental health professionals as individuals, even as a collective. It has to do with health systems, because as I mentioned before, mental health has been chronically underfunded. So this is one. And second, I want to come back to something that you asked, why our youngsters today feel more stressed or distressed than previous generations, when it is clearly people have a better quality of life today. And I think we need to bring here the notion of well-being. We have higher expectations now with the passing of the generations. We have higher expectations to have a better well-being, to have a quality of life, and people feel entitled to expect better quality of life, which is also which is something that we need to factor in when we design, as a society, as the class of policymakers and service providers design mental health services. So in addition to mental ill health, we need to consider the rightful expectation of the society for well-being and for quality of life.
Let's throw that. Can I just throw that out there? Because
please.
I'm going to play devil's advocate here and say, effectively what Ledia is saying is that people are expecting too much. That this is just life. I know you're not putting it in those terms. That cruelly, but I'm interpreting it. Just get on with it, perhaps, is the answer, isn't it? Because you're expecting too much. You're always feeling let down. You've got this fear of missing out, this FOMO.
This is not what I heard. The way I'm interpreting is that we should place greater emphasis on prevention. We have emphasis on mental health, mental illness. We have very little research into the factors that promote well-being, or we design the intervention around remediation of mental health issues, but not so much around promotion of mental health. And prevention is the best cure, as we know. And that's what I think
I wasn't suggesting that you were being dismissive.
And I
was
totally
taking
agree.
what you were saying and then putting it into my own words in a different way. I hope you understand that, Ledia.
Yes, no, I understood where you're coming from as well. And I think it's okay for us to expect support in terms of mental health and well-being promotion. And particularly, we should expect our society, our educational sector, to equip our children, our adolescents, with the skills of self-regulation.
But if you're always expecting too much because your peers say that's what you should expect, because society says this is what you deserve, then you're always going to be disappointed.
What comes to mind is a quote by a mindfulness teacher, Thich Nhat Hanh, and he said a wonderful thing. There is no way to happiness. Happiness is the way. And if we teach our children, we teach our adolescents that their well-being is not going to come from what is there externally, the amount of money they're going to earn, the successes they're going to achieve academically in their career, but how they relate to life, how they approach life challenges, how they approach communication.
Be happy with small things.
Well,
Just
with appreciating small moments of life, but not taking away the burdens and the challenges that young people in particular face in these days. So I don't want to make the issue trivial and say, it's our responsibility to make ourselves
No,
happy
but
and teach the
believe me,
same.
by sitting here, we are not trivialising this
Yeah.
at all. And I just want to ask you, Cyrus, that perhaps the secret is in simplicity, but to become a simpler society, we're going to have to start all over again, aren't we? We have to live with what we've got.
Well, Facebook was down recently, as you know, so I probably created a simpler society for a few hours.
Not for me. I was trying to use WhatsApp to send messages about this programme.
Indeed. Yes, I don't think we're going to go back to a simpler life. I think we have to learn, all of us, not just children, but adults and adolescents, we have to learn to use technology in a way that doesn't affect our well-being negatively. Because well-being is so important. Ultimately, I'm a psychiatrist, and people think I just prescribe medication. But I talk about really basic stuff with my patients in terms of having a work-life balance, not spending so much time online. A lot of children have got a fake persona, almost like an avatar they create for themselves online with Instagram. And in that avatar, they're superstars, they're athletes, they're models. But it doesn't relate to reality. And I think that sort of realization that, you know, what they create is actually a fantasy could be one of the reasons why they struggle so much with anxiety and depression.
I mean, social media is blamed for so much, but do you think it actually could be the source of one of the biggest ills to have hit this world? That it actually makes people's expectations so high that they're always going to feel that they're let down?
I mean, the preliminary research, certainly over the previous 18 months, is showing that it can be really negative. I mean, in terms of, we have, generally speaking, we have a lot of fake news out there. We got the anti-vaxxers, for example, have got a platform to basically propagate propaganda. So it can be used negatively. And I feel that our children who are currently growing with social media are going to be adversely affected as a result.
And one of the other dangers, Elena, I think you've pointed out, is that being with so many people but not in reality makes people lonelier.
And we have research coming out around, there is even a new term, Zoom fatigue, you know, and the difficulty both emotionally and cognitively to process facial expressions, emotions of people online. You know, having this head and shoulders format has been incredibly difficult for children and young people at universities. And as a mother of teenage children myself, seeing how they struggle, particularly my elder daughter, who doesn't like spending too much time on devices because she, you know, literally feels energetically sucked by it. So having to spend an incredible amount of hours on a daily basis in front of the computer, being schooled online, has been very difficult.
Can I read this out? This is from your organisation, Ledia, WHO. The COVID-19 pandemic has had a major impact on people's mental health. We're discussing that. Some groups, including health and other frontline workers, students, people living alone, and those with pre-existing mental health conditions have been particularly affected. And services for mental, neurological and substance use disorders have been significantly disrupted. Your biggest message to those people on World Mental Health Day, Ledia, would be what?
Stand by each other, express solidarity. The help is one call away. We, even in the most difficult situations where there is no mental health service available, there are always people around that we need to reach out for, and we need to be supporting too. So in addition to all the policies that governments and other partners are taking into consideration now for changing and for modifying in order to respond to these new challenges, to the larger community, the main call is accept mental ill health as part of the normal vulnerabilities, reach out for each other, be there for each other, and get through this all together.
Jayne, with you in just a moment, but Cyrus, from a professional point of view, what do you believe Mental Health Day can achieve?
Reduce stigma. If you want help, ask for it. If you're feeling depressed, don't be scared. It doesn't mean you're weak. Get help.
So ask for help, but Jayne, isn't that the problem? You did and it wasn't there.
Absolutely. It absolutely isn't there. And there's just something that I would like to say, something that my daughter said to me. If I had a problem with my work and it could kill me, I would be kept in hospital, I would be treated, I would be made sure that I'm stable, and then I'd be released. I've condition, this is what she says, I have got a condition that could kill me tomorrow and I just get sent home. I don't believe that there is another illness would be acceptable to have a headline of 75% of young people do not get treated. I cannot imagine that we would accept 75% of children with cancer, 75% of children with diabetes. Why is it different? And why are we talking about health as something that doesn't kill people, that doesn't make them really, really poorly? I think that we need to use this to raise awareness and make people aware of just how important it is that mental health is treated.
Well, you've had several thousand views of your video. I know you've had a lot of people getting in touch with you. Thank goodness for the conversations that people are having worldwide, and we thank you for taking part in ours here today. Thank you very much for joining us. Emma, Jayne, Ledia, Cyrus and Elena, thank you wherever you happen to be watching this edition of Roundtable. I'm David Foster. I hope to have your company on the next occasion that we sit down here. Until then, goodbye.